wellbeing economist Professor Talita Greyling from the University of Johannesburg and Dr. Stephanié Rossouw from Auckland University of Technology have shared the latest happiness index, which shows that President Ramaphosa's speech recently heightened emotions around the vaccine debate and added to the already high levels of negativity. So let's talk about this study, and we joined via Zoom Professor Talita Greyling, researcher in the field of well-being economics and development economics at UJ. Thank you very much for coming through.
Thank you very much for the invite.
All right, let's just do some establishment of some information and definition of terms here. Tell us about the tools that you use to guide South Africa's mood in terms of the issue of vaccine, the skepticism about it when it comes to South Africa, you know, men on the streets, besides, you know, those who know more about it.
So what we do is we develop the measure using big data. In this case, we're using Twitter. So we extract all tweets made by South Africans per day. Now we've got about 11 million Twitter accounts, representing about 18% of the population. And that accounts for 60,000 tweets per day. And then we use those tweets and we use what we call natural language processing. It's sentiment analysis. And from the sentiment analysis, when we get that scores, we use an algorithm from which we then derive the mood average, so the happiness index, which we report on. And lately, we've also looked at the underlying emotions of those tweets. So we're looking at emotions and the happiness.
So, to challenge your research, why only one social media? Why not Facebook? Because you remember that on Twitter, people are not, you know, posting lengthy or opinion pieces. But on Facebook, other people speak and they get to debate differently because, you know, in townships, for example, they say Twitter is the suburbs and Facebook is Shisanama, you know, like that kind of, you know, societal imbalances in terms of LSMs and so forth. So is your view not really biased in terms of using only Twitter and not Facebook?
Well, the first question you asked is why do we not use Facebook? We would love to use Facebook. We really would like to, but we are not allowed to. So there's so many privacy clauses around Facebook that is not allowed to be analyzed by academia, researchers. So we don't have another option. We've got Twitter. Your next question is Twitter actually then representative? Who does it include? Now, if we look at Twitter, then from a data point of view, data is never perfect. But we have to do with the best we can get. So let's look at what else we can get to measure the well-being of people. And that will be a survey. Now, the surveys in South Africa, the biggest surveys we can get is round about on 32,000 individuals. So this is now compared to where we have 11 million Twitter accounts with 60,000 tweets per day. So the sample is just much bigger. And if you look geographically, you will see people tweet all over South Africa. Even in the smallest rural area, you will find tweets.
Let's now take it back to the pre-level 3 announcement. What was the happiness index of South Africans before the ban of alcohol?
Well, if we look at, because it's now through 2020, so there's a few times that the alcohol has been banned. And initially, if we look at the average level of your happiness, it was around about 6.2 in 2020. But now, just after the president's speech on Monday, we found that it dropped to its lowest ever. Per hour, it went down to 4.2.
Then
and it's measured on a scale from 0 to 10.
Okay, so then what about the debate regarding the vaccine? Have you gauged the mood of South Africans in terms of, you know, the fear and confidence ratio? some saying, following allegations of DNA altering elements of vaccines, or have you done your research? Don't you know that the vaccine will help people to survive and live longer? That kind of dichotomy in as far as your research is concerned.
What our research do is only look at a tweet and we analyze the emotion in that tweet. And what we did find is that the emotions in the tweets related to vaccines are very, very negative. So we see the negative emotions that we pick up is anger, for example, sadness, and those type of emotions increased by 40 to 90%. Fear increased by 90% compared to previously. So what we can see is the mood around vaccines is really very negative.
So what drives the emotions about these vaccines? Looking at the information out there is exacerbated by conspiracy theories versus a government not really being forthright with dismissing conspiracy theories and dealing with each and every conspiracy theories specifically and responding to it so that it can allay fears. So the information out there looks like there's an oversupply of conspiracy theories, but little confidence in initiating and inducing information for members of the public.
You are spot on, very true. There's quite a few reasons why people are very skeptic about the vaccine. One is the conspiracy theories, and then there's also a lot about the vaccine was developed too quickly, so they don't trust it. They don't trust the process, the rollout process by the government. They are unsure if there will be sufficient vaccines for everybody. So a lot of debates around this. And then on the conspiracy theory, what our concern is about that, conspiracy theories are driven by fear, which increases the negative emotions we experience in South Africa currently. Now, negative emotions is really something we don't want because it's got a negative impact on your economy. People are less productive if they are negative. They're less healthy. In a time that we've got a pandemic, people must look after their health. If they're negative, it's got a negative effect on their health. Their ability to learn, their type of social relationships, all of those are negatively affected. So from a point of view of all leaders, this means religious, trade unions, politicians, the whole message about vaccines, they must put in a very positive manner. And they mustn't be unsure about what they're saying. It must be a clear, precise, what is happening, how will they pay it, very transparent, because that's the only way we will change that negative mood into a positive mood.
So on a parting shot, some South Africans are not happy with not being able to buy and consume alcohol, let alone transport it. And also, on the other hand, some are not happy with not going to church, besides considering that public events are super spreaders. But on the other hand, government is wary of the numbers that have been on the rise, which are supposedly now dropping. So if you were going to gauge the happiness levels of South Africans, what would you say with a direct answer? Are South Africans happy or not?
At the moment, and we can just compare scientifically to what we found previously, the mean happiness for South Africa is approximately 6.3, that's in 2020. Currently, it's 6.1. So we are below your mean level of happiness.
So South Africans are unhappy. Is that what you say? Is your research
I'm not saying we are unhappy. What I'm saying is our happiness is at lower levels than before.
Okay, we shall leave it at that. I wish we could debate this further, but due to the interest of time, we're going to have to leave it there. Thank you so much for making time.
That's a big pleasure.
Right.
Thank you.
Okay, South Africa, of course, happiness levels there. And the question would be, you as a South African, are you happy or not? Well, Professor Talita Greyling is researcher in the field of wellbeing economics and development economics at the University of Johannesburg.